I do think that what has happened now with the intersection of the disproportionate impact of COVID-19 and the Black Lives Matter movement, that those intersections have really highlighted the disparities I think that this population has experienced and really provided a platform and an opportunity for there to be some concerted efforts. That's why this has become one of the top priorities. How do we increase access to care for members of the Black community, but also other diverse groups, essentially? And so getting those numbers to go in the opposite direction, I think, ideally is a measure of success. I think that challenges are how do you get into communities to really help to affect change. When I think about mental health and suicide prevention, I tend to think about the concept of mental health literacy. So I think that requires effective mental health literacy requires a different way of teaching about this subject to different populations. I think the beauty of a public-private partnership is that it really allows for a collaboration of thoughts, of ideas, also resources. This collection of voices really provides an opportunity for all members of society to have some level of representation at the table. The things I have appreciated in the short amount of time that I've been associated with the Action Alliance is the multiple voices that are represented, and I think that again that's reflective of larger society, and I think that's ideal if we want to make a tremendous impact. If you think about those in our society who might identify as essential workers, those who might have pre-existing health conditions, we think about some of the comorbidities, and overwhelmingly in this country, those individuals tend to be representative of multicultural or diverse groups. I think about individuals who are able to order groceries and have them delivered. Most often, we think about lower socioeconomic status, and in this country that typically intersects with race. We've seen a significant disproportionate impact as a result of that. A long-standing history of inequities in terms of medical access to medical care that contributes to some of the apprehensions that some populations might have in terms of utilizing resources. Even in the education of people who are going to be delivering care, we see that whether it's again lack of exposure to populations, to diverse populations, or poor cultural competency, they end up receiving poor care. There's often some stereotypes that are attached to the care that they might receive, and so I think all of those things are a combination of factors that really impact the delivery of care to particularly Black Americans. If we think about the financial stress of being unemployed, if we think about lack of housing and homelessness, and those are conditions where the stress, when it's allostatic load, the stress levels are always high. And so we know, again, the combination of those things is going to have a deleterious effect on emotional well-being.